at Trinity Health to talk to Dr. Hussam Shaker, who is an expert, a neurologist, has the key factors between epilepsy and seizures, which, truth be told, doctor, I didn't know much about this before walking in. So thank you for being here and telling us what is the difference between someone having a seizure and someone suffering from epilepsy.
Thank you. It's a good question. So seizure is a symptom. Epilepsy is a neurological disease or disorder. Seizure is abnormal electricity in the brain that result in some symptoms. Some people, they have shaking. Some people, they have weird taste, smell. They stop talking, behavioral arrest, deja vu. All these symptoms are seizures. But 1 in 10 people, they might experience 1 seizure in their lifetime. It does not mean they have epilepsy. Epilepsy means you have at least 2 unprovoked seizures, and then your brain is more susceptible to have more seizures. In other words, if normal, healthy people, their threshold for seizure here, people with epilepsy, their threshold is here. So they have risk to have recurrent seizures.
Let me see if I can break this down into hopefully layman's terms. It sounds like you're saying that the pathways of the brain when you have a seizure are more open for the next time something could trigger a seizure. So it becomes easier for the brain to have that seizure.
Yes, yes. So people, they might have seizure for multiple reasons. For example, if people have high sodium, low sodium, they might have a seizure. If people start a new medication, they might have a seizure. People drink too much or stop drinking quickly or suddenly, they might have a seizure. But that does not mean epilepsy. Epilepsy means unprovoked recurrent seizures.
Got it. So if that is happening without a trigger,
absolutely,
and it's happening often, epilepsy.
Yes, epilepsy.
Okay, so let's talk about those triggers. I mean, we see the warnings when you see movies, flashing lights.
Yes.
What are the common triggers for epilepsy?
Yes, so in general, I tell my patient, number 1, sleep deprivation.
Really?
Yes. Lacking of sleep is a big factor for having seizures. And that's why, unfortunately, most of our patients we see, they have first seizure around Christmas Day, Thanksgiving, 4th of July. So that's, most of my new onset seizure patients, they tell me that, oh, my first seizure was around that time. So lack of sleep is number 1. Excessive alcohol, number 2. Missing doses of medications also sometimes causes seizures. Any infection might lower seizure threshold. As you mentioned early, light or photic stimulation in specific type of patients, it triggers seizures.
Yeah. So we see that a lot more than just the lights, which I'm
Yes.
sure most people are familiar with.
Yes.
How do you treat this? Once someone's been diagnosed with epilepsy, what can be done to limit or stop those seizures?
Yeah. Good news, 2/3 of our epilepsy patients, they have seizure freedom only on medications. So 2/3 of patients, we can get them seizure free on 2 medications, okay, 1 or 2 medications. And we have more than 30 anti-seizure medications available for these patients, 1st generation, 2nd generation, and 3rd generation now, with less side effects. If patients, 1/3, they don't respond. So those people, and the chance of seizure freedom in this 1/3 is only 8%, regardless of what I do. If I add 10 medications, the risk is still high for recurrent seizures. If I take this 1/3 to the surgical route, and I do stereotactic EEG and I understand their epilepsy, the chance of seizure freedom between 60 to 80%.
Amazing. So you're saying that 2/3 respond well to the medication, but that 1/3 of epileptic patient that doesn't respond, this surgery could really, really help. You call now, it was a big name. You want to say it again, the EEG?
Yeah, it's a stereotactic electroencephalogram, or SEEG.
Okay, and what happens in that procedure?
So it's minimally invasive. It's a methodology that allows me to do 3D exploration of the brain. So we are able to use a robot to place electrodes deep in the brain in areas we were never thought we will go there. So for example, like insula, orbitofrontal, cingulate, these areas, for years, no one can go there. They are very deep in the brain. Now, we have the technology to go there, put electrodes, and record seizures from inside the brain. So we are not guessing. When we put scalp EEG, we're still far from the generator of epilepsy. But when I place electrode inside the brain, so I see where seizures start, where it goes, where it spread, where it ends.
You can completely just trace the seizure.
Yes, so every patient, I tell them you have your own highway of seizure. So I start here and go there. So everyone, they have their own highway.
So we've got this amazing surgery, we've got medication. Is there anything else done for epileptic patients?
Yes. So when I do this SEEG, I understand the epilepsy. Then we meet as a group in Trinity Health here. We have multiple well-trained epileptologists, neurosurgeons, neuroradiologists, neuropsychologists. We meet and we discuss this epilepsy. And we see what's the best option. If we can do laser ablation, like from outside, with we put a probe inside the brain and ablate that area, we do it frequently, and we do that. If we feel that area is better to be resected, then we have the neurosurgeon to go there and resect this area to get them seizure freedom. If we think this area is very important, we cannot touch it, like hand area, eloquent cortex, like speech area, language area, vision area. I cannot remove this area. So we put a chip in the brain, what we call it neurostimulation. So we put a chip in the brain. We train the chip. When you see the seizure is coming, give stimulation and stop the seizure.
Look, I know it's a horrible pun, but you're blowing my mind right now because you're talking about putting electrodes inside people's brains that can sense something coming and then do something.
Yes.
I mean, that's pretty advanced technology.
It is.
That's amazing. And that's all happening right here at Trinity Health.
Yes, in Trinity we have all this advanced technology here and good team for that.
Okay, so if that is your world, anybody epileptic in your life, this might be the route for them. Bring them to Trinity Health. Get that amazing diagnostics tool where they're actually tracing and following the seizures. And it's all waiting for you at trinityhealthmichigan.org.